Every child deserves a healthy start in life. They should have the opportunity to experience the health benefits of daily physical activity and good eating habits, which influence weight. Yet, in Missouri, obesity is becoming a growing problem for children. That's why all through September, which is National Childhood Obesity Awareness Month, the Missouri Department of Health and Senior Services is shedding light on this growing problem. Today I'm joined by Pat Simmons, a registered dietitian with the department, who's here to give us the facts about childhood obesity and to share with us what we can do to help our kids live longer, healthier, happier lives. Pat, welcome.
Great, thank you.
Why do we need to worry about obesity in children? Won't they just grow out of it?
Brian, we really do need to worry about it. For Missouri, about 1 in 4 children are considered overweight or obese, which is an alarming number, and unfortunately, no, they don't necessarily grow out of it. We have the opportunity from very early on, we know from birth to age 5, as a very critical period for influencing healthy habits and for influencing future health. For example, we know that children that are breastfed have lower risks of obesity as they continue to age. As I mentioned, that time period of birth to age 5, they're establishing some pretty important health habits as well, learning about foods, making food preferences, and learning about being active. And so if we can influence children during that time period, we really are ahead of ourselves as far as encouraging a healthy weight on down the road.
So what can be done to reduce childhood obesity?
Childhood obesity, or obesity in general, is a very complex problem, and so there's a lot of different efforts that we need to make. And we know that where we learn, live, work, and play can influence whether or not we end up healthy. And so in terms of addressing it, we need to think about the environments that we live in. Do we have places to be physically active, or do we have places that we can access healthy foods like fruits and vegetables? But also, individually, there's also things that we can do to influence childhood obesity. We know that kids oftentimes are looking up to parents and want to be doing the same thing. So if we're eating well, then chances are children will be eating well.
So how does the department support healthy environments?
The department works in partnership with a lot of different agencies and organizations, the main one being Missouri Council for Activity and Nutrition, to work on different projects and interventions that will help to reduce obesity. And we know that our work primarily focuses on policy and environmental changes, and because we know that those will have the biggest impact. One project that we're working on is called the Missouri Eat Smart Child Care Initiative, where we're helping child care providers serve healthier menus, and then also an environment where the kids are going to learn healthy habits. Another project that we're working on is the Missouri Breastfeeding Friendly Workplace Program, and that program really supports employers that are supporting women that are returning to work that are breastfeeding.
Are we seeing success with the efforts that are ongoing, and what's working, what's not?
We are seeing success, and in fact, the Centers for Disease Control and Prevention recently released a vital signs report that showed childhood obesity is decreasing in many states, and Missouri happens to be one of the states with the largest decline. So definitely the work we're doing is making a difference.
So these sound like very large efforts. What can I do to help with this issue?
Well, I think it's important that every individual be concerned about this issue, because it really will impact the whole community. And as an individual, there's a couple of different things that I would suggest. One is just making sure that you're talking to anyone about it, anyone you can. If you're part of a civic organization, to just make sure that the members are aware that this is truly an issue, and that there are some things that you can be doing within your community to help improve access to healthy foods and places to be physically active. Also, though, you can host like a potluck, for example, and where you encourage everyone to bring healthy foods, and just helping others understand the importance of health. But also, you can advocate in your community for healthier environments. So for example, you could go to your city council or to your mayor and ask to have a proclamation issued in honor of Childhood Obesity Month. Or you can also just make sure that they understand that you have that you would like to have a healthier environment. So can they, for example, work on having more farmers markets in your community, or can they work on putting some additional trails in, those type of things, and making sure that they know that their community members really want to see those things happen.
Pat, thank you so much for being here during National Childhood Obesity Prevention Month. We appreciate you being with us.
Thank you.
For more information about obesity reduction through nutrition and exercise, visit our website at health.mo.gov.